Hello, this is for our Module AB End of Life Assignment Part 2 with myself, Raquel Crumbach, and Braden Signs. I will be playing the role of the nurse, and Braden will be playing the role of the daughter of the client. And if you're ready, Braden, we can go ahead and get started.
My name is not Martha.
All right. Hello, Martha Willis. I'm Raquel. I will be the nurse providing care to your father, Russell Willis. I understand this process may not be easy, but I need to go over a few things with you. As you're aware, your father was diagnosed with coronary artery disease 2 years ago and is a diabetic and has chronic high blood pressure.
I'm aware. I've been trying to keep him on a healthy diet and been bugging him about quitting smoking for years, and sadly, nothing has worked, which explains why we're here having this conversation now.
He has completed advanced directives such as a living will, a power of attorney, and a do not resuscitate order. The person he has listed in these documents to make decisions for him in the case that he is incapacitated is your mother. Are you aware of these documents?
Um, I think I know what a do not resuscitate order is, from watching Grey's Anatomy in House, but what is a living will and a power of attorney?
Good question. A living will is a document for the patient to fill out stating exactly what life-sustaining treatments they want performed on them. And a power of attorney is a document that a patient appoints a specific individual, in this case, your mother, to make healthcare decisions on their behalf if the patient is unable to do so. Does that clarify these two documents?
I think I understand. So the living will basically states like, hey, this is what he would like done to him. As far as medical treatment goes in the event that he's in a coma or something in a similar nature. And a power of attorney just says that only my mom can make those decisions and no one else, no one, just random doctor, nurse, or even myself.
Yes, that's exactly what those two documents mean.
Okay.
As far as interventions I'll be doing, if your father's experiencing any trouble breathing, we can administer an opioid such as morphine, which we will talk about a little bit later. And we can provide him some oxygen, supplemental oxygen, to decrease his breathing difficulty and decrease any anxiety that he might be experiencing. Oftentimes, if patients are having trouble breathing, it'll increase your anxiety. So the morphine will help with that. If you hear any kind of like rattling noise coming from his respiratory tract, that could be secretion buildup in his respiratory tract. And I'll first try and reposition him. And then we can administer what's called oral atropine drops, which again, we'll talk about in a little bit. But those will just be to help dry up the secretions that are in his respiratory tract. For pain, we're going to first try non-pharmaceutical interventions such as repositioning, relaxation techniques, music therapy, or heat and cold therapy. If he's still in pain after those, he's not stated against the want of using main pain medications. Therefore, we can manage his pain with medications that are targeted to relieve that pain, such as morphine. If he's experiencing any like fluctuations in body temperature, we can manage that with heat and cold compress, warm sponge baths, blankets, or adjusting the temperature in his room.
Okay. And are any of these things going to help him live longer? And I've also heard that morphine has had some bad side effects and it could be very addictive. Uh, what resources are going to be available to him whenever we get out of the hospital?
Yeah, so the qualifications to enter hospice care is the life expectancy is less than 6 months. And based on your father's diagnosis and how long he's had heart failure, he's at the point of being in hospice care where the goal is centered around palliative care. With that being said, palliative care is any kind of care we're doing for him to make him as comfortable as possible. We're not worried about the possibility of addiction at this point. We're far more concerned with treating his pain and keeping him comfortable. Your father is in a hospice care facility, as you know, and therefore the focus is going to be on palliative care.
Okay. And so just to repeat back what you said is life expectancy less than 6 months. And this everything that we're doing now is not treatment for what he's been diagnosed with is entirely like, hey, we want to make sure you're pain free and comfortable while you.
Yes, trying to give him the best
Okay.
quality of life that we can at this
Okay.
point. Okay, a few more items. Care provided to him will be from a group of healthcare professionals. So other people you might see walking into your father's room could be the cardiologist. He's going to be Dr. Hart. He will be managing your father's heart failure and provide any necessary diagnosis or treatment plans. And he can prescribe any medications that might be administered or any referrals if needed. Another person you might see is going to be Amy Gold. She's the nutritionist. She'll be providing diet modifications and develop a nutrition plan for your father.
Okay. I'll keep an eye out for other doctors entering my father's room.
Okay. The last thing I would like to speak to you about is 4 specific medications. So one would be morphine that we kind of touched on a little bit earlier. That's going to be to help with your father's pain. Atropine, that's going to be helping with clearing any secretions in his respiratory tract and help decrease his difficulty of breathing. We have glycopyrrolate, which will help with breathing difficulty as well, and Ativan to help decrease any anxiety that he's feeling.
Okay, and are any of these medications going to shorten his already short lifespan? Basically, are they going to be safe to use?
Yeah, good question. No, it won't shorten his lifespan. The objective of each of these medications is to help him be more comfortable and have a better quality of life. Things to know are that the side effects of some of these medications, for example, atropine, which was used for the respiratory secretions, may cause him to have constipation, nausea, vomiting, or nasal decongestion, or I'm sorry, nasal congestion. With Ativan, which we're going to use to treat his anxiety, it may cause him to experience dizziness, sedation, or delirium. With morphine, which we're going to use for his pain, it can cause his heart rate and his respiratory rate to lower. And with glycopyrrolate, used for his breathing difficulty, it can cause vomiting, delirium, and hallucinations. So these are all expected side effects, but I just want you to be aware of them. That way, if you're experiencing or you're witnessing any of these side effects he's experiencing, to not worry about it. Keep in mind, whenever the physician is considering prescribing and administering any of these medications, it'll be assessed as the possible side effects against the benefits to each one of these. And then the physician will come up with whether it's warranted to administer these medications.
Okay.
For every healthcare professional here is here to assist your father and your family needs. So please do not hesitate if there's something you're concerned with, have any questions about, or need any assistance with. Especially with these medications and these side effects, if you're having any questions about something you're witnessing your father experiencing, don't hesitate to ask us. We're happy to help and be here to assist you and your family with whatever you need. Regarding the information I went over with you today, do you have any additional questions?
I think you answered everything great. The only other question I have is if there's going to be any religious personnel at the hospice center, or we bring someone with us, and how that kind of works.
Yes, I'm glad you brought that up. So part of what your father has put in his wishes is that he does want a priest present. And so I don't know if you guys have a family priest you would like to use, or if you want us to find a priest, but if you or your mother or your father have a specific priest, I can work with the family to make sure that a priest is present. But yes, that is something he put in his wishes, and I've made sure to document that and put it in his chart. That way all the healthcare professionals know his wishes, and that's including the DNR, I'm sorry, the do not resuscitate order, the living will, the power of attorney, and his religious preferences. So those are all charted. Everyone should be aware of them, and we'll make sure that he gets all his wishes and needs.
Okay, awesome. Thank you so much.
Okay, thank you for your time.